Chronic and acute health issues are faced by any elderly person. Aging, lifestyle, and genetics contribute to cardiovascular, respiratory, gastrointestinal, genitourinary, and neurological illnesses. In addition to those, the elderly LGBT population is at risk for many other physical and psychological diseases and disorders. Lack of physical activity, social isolation, alcoholism, tobacco dependence, use of illicit drugs, high-risk behaviors, victimization, and violent experiences are risk factors that surround the LGBT community. These factors contribute to obesity, depression, anxiety, suicidal ideation or self-mutilation, substance abuse, and HIV exposure, particularly among the transgender population who lack social support and may feel unsupported by the non-transgender LGBT community. As antiretroviral therapy continues to improve, persons suffering from HIV infection are living longer lives, but the effects of the disease and medication regimen cause inflammatory responses, contributing to cardiovascular disease, lung disease, liver disease to include hepatitis B and C, type 2 diabetes, lymphoma, and HIV-associated neurocognitive disorder, or HAND, which are deficits in attention, language, motor skills, memory, and other aspects of cognitive function. Disparities exist among the health care provided to people identified as LGBT, and particularly those who identify themselves as transgender. Many have a fear of accessing health services because of discrimination felt by healthcare workers and physicians. In addition, many do not have healthcare insurance or the ability to afford services. Internalized stigma and identity concealment, as well as discrimination, harassment, victimization, and violence are all obstacles in providing adequate healthcare to the LGBT elderly. Lack of social support, and in particular for the transgender population, the lack of community belonging, lead to poorer health outcomes. Many LGBT suffer financial strain and unemployment due to discrimination and workplace harassment. Even within the LGBT community, discrimination exists in the form of ageism, where the younger generation isolates itself from the elderly population and they're left alone and unsupported. Nursing and the medical field can take action to eliminate disparities and promote health among the elderly LGBT population. The focus should be on respecting one's independence and providing quality care, as well as respecting one's sexual privacy. Methods proposed include promoting equality of treatment, the need for training medical personnel in LGBT concerns, providing supportive assisted living facilities protected by federal regulations, recognition of dominant healthcare issues and unfair legal practices, increasing research into LGBT-specific needs, and developing a culture of respect for the roles of partners and significant others. Among the most important legal and societal issues that need clarification and legal support is the identification of spouse or partner as healthcare power of attorney in the event of incapacitation. This includes providing a nurturing and supportive environment at long-term care facilities to allow loved ones and families of choice to be at the bedside of the person as their time of death.